Patient numbers at Taiwan's hospitals and doctor surgeries have fallen dramatically over the last 6 months, according to the National Health Insurance Administration. Doctors recorded 15.5 million fewer appointments than in the same period in 2019.
That means doctors' visits have dropped 8% as the public steers clear of any virus hotspots. But doctors are warning that citizens should not put off even routine health screenings for too long.
As the threat of coronavirus recedes, some are daring to venture back to the doctor for minor ailments, when a few months ago they might have abstained. NHI figures show that appointment numbers fell by 8% on average over the last 6 months, with emergency visits room dropping most dramatically by 16%. Mortality rates also fell by almost 1.5%. That's resurrected the eternal debate over wasteful doctor's appointments.
Actually, we shouldn't call them wasted. Rather, when the public better understands how to protect themselves, then they won't catch so many infections. There will be far fewer infectious colds. Over the whole last 6 months, the load on the services of the whole medical system has fallen by about 11%. For big hospitals, the fall has been smaller. At local doctors' clinics and at local community hospitals, the drop has been slightly bigger.
At Shin Kong Wu Ho Su Memorial Hospital, for example, pediatrics, ear, nose, and throat, and the psychiatry departments have all seen a noticeable thinning out of patients. But some doctors are concerned that as people skip routine checkups, even patients with cancer or chronic illnesses, Taiwan could now see an uptick in cases of serious diseases like cancer.
At our hospital throughout the pandemic, the drop in numbers of people coming in for their health checkups has been about 40%. A health checkup is not something you're going to prioritize in the middle of a pandemic, as it's a non-essential medical appointment.
The NHI says uptake of its cancer screenings has fallen by somewhere between 10 and 20%, with oral cancer screenings getting skipped most often. But they say right now when patients are fewer than usual, it's the perfect time to pop in for that screening you've been putting off.